Chad Myeroff with TwinCitiesShoulderAndElbow.com, shoulder and elbow specialist, here to talk to you about something that you may have heard about and may be an option for certain conditions of the shoulder called the reverse shoulder replacement. So what is the reverse shoulder replacement? Now, to understand that better, we have to understand the standard total shoulder. So most shoulder replacements, especially historically, have been replacing the ball with metal ball and replacing the socket with a plastic socket. And those are designed for wear and tear arthritis called osteoarthritis. Now, in some cases, the wear and tear pattern is severe and the socket gets dramatically worn out. Other times there's rotator cuff tears associated with your arthritis, or something called rotator cuff tear arthropathy, where your rotator cuff has been torn for so long and it's so decayed and injured that repair is not possible. Those are several cases where reverse shoulder arthroplasty may be the best option available to you. Now, the difference in a reverse shoulder replacement, instead of replacing the socket with a socket, we replace the socket with a ball. So we put this metal base plate on your socket, and then we replace that with a ball called a glenosphere. On the other hand, on the other side of the shoulder, we put a stem down the ball called the humerus, and that stem is attached instead of a ball with a socket. So we flip the two. That's why it's called a reverse shoulder replacement. Now, at the conclusion of the surgery, we make sure these parts are perfectly balanced for you. They're sort of customized at that time. Sometimes they're customized with 3D planning prior to surgery, where we can make special guides to correct for severe bone wear. Either way, the goal is to get a balanced reverse shoulder replacement. Now, the reason this works is it's designed, again, for people who don't have a good rotator cuff. Normally, if you had a dysfunctional rotator cuff and you put a total shoulder in, it will not help with your ability to lift the arm. In this case, because we flipped the ball and socket, it's a contained device. And when your big muscle out here, the deltoid, fires, instead of the ball just shooting up, on the other hand, it will then be able to pivot like a normal shoulder when the deltoid fires. So this reverse shoulder replacement is a really handy option. It's designed for complex scenarios where a previous shoulder replacement failed, where the rotator cuff is no longer useful or repairable, or very severe arthritis where the socket has been so worn down that a standard replacement would not be reliable. So it's important for you, if you've heard about this option, if this has been presented to you, or you're wondering if you do have options for a very complex shoulder injury, it's important that you come see a specialist who understands all the options available and advancing technology, so we can understand your imaging, your exam, and what you want to get out of your shoulder to see if this may be the right option for you. So please book an appointment with us online, virtually, or come in person, so I can have a chance to help identify the best way to get you the best possible function out of your shoulder.